So I'm just here to take a moment to speak about a few issues around the manner in which many professionals attempt to use research to make claims about what they're doing with respect to the immune system, with respect to viruses. Now, this video is somewhat timely in that I'm making this around the time that the current novel coronavirus is spreading around the world. It's also timeless in that this is something that happens around many professions, and the way that they utilize research, or the way they utilize research to make incorrect claims or claims that can be harmful. Now, if you are watching this simply on YouTube, below in the description there will be a link to my website where there's an article that has a few links and describes what I'm trying to show here, or the point that I'm trying to make. Now, the broad point that I'm trying to make is that within osteopathy, there are grand claims that we're able to improve immune function. There isn't really evidence that this is an honest statement. The evidence that exists shows osteopathy in conjunction with essentially conventional care for viruses, for infections, which usually includes vaccination and good hygiene, might be a positive impactor or a positive influencer. At no point have I personally seen any research that says for sure osteopathy boosts the immune system, or osteopathic treatment boosts the immune system above the point that the immune system is able to function on its own under conventional care, including vaccination, good hygiene, or other antiviral agents. Now, there is this desire to look at the past, specifically the Spanish flu of 1918-1919, and say that osteopathy performed so well, about 40 times better than those under care by an allopathic physician. Now, the challenge with that, first of all, is data collection challenge. Do you trust the way the data was collected in 1918-1919? My understanding with respect to the claims made by the osteopathic profession is that there was a survey sent out and that people responded, and it showed about a 0.25% death rate, if I remember right. I may be somewhat incorrect in that. However, when comparing what was done by osteopathic practitioners at the time to allopathic practitioners at that time, there's a pretty basic issue here. In that Spanish flu epidemic, there was still the practice of bloodletting, not much, but a lot of purgatives. There are very, very few instances of bloodletting to my knowledge in 1918-1919, but there was the use of purgatives. So you're taking somebody who's infected, and you're essentially trying to make them vomit quite a bit. Now, that doesn't go very well for somebody who has underlying health conditions. We know this now. We may not have known it then in a broad sense. When you look at what osteopathic physicians would have done, they would have done hands-on treatment, and that's about it. So gentle hands-on treatment may make the patient feel more comfortable, a little bit happier, what have you. There are instances where hands-on treatment may make somebody objectively worse, but subjectively feel better. I believe such is the case in at least one study that I've seen with respect to osteopathy and COPD. Osteopathic treatment applied to a patient with COPD makes them objectively worse as far as respiration is concerned. However, they may subjectively report feeling better, and there's an issue there. So we have to trust, if we're to use anything in the claim that many practitioners will make about the 1918-1919 Spanish flu, we have to trust data collection, we have to trust that people were honest on this survey. There's a lot of problems. And again, I outline this in the longer article in the written form on the website. But what I want to caution everybody with is that if you are not regularly reading scientific literature and you attempt to use it in a cherry-picking fashion, many people are accused of cherry-picking, and it's not unique to any one scenario. It's a pretty common thing. You're going to aim to find things that will support your view. It takes a lot of effort to actively identify things that both support and negate your view. That's a skill. If you are not regularly reading scientific literature, do your best to read it as diligently as you can. Develop the skill of reading and identifying what is said, because most of the studies that I've seen shared with respect to osteopathy and immune function, or osteopathy and anything else, people just don't read them appropriately. The limitations of the studies are often clearly defined, and despite being clearly defined in these papers that I've been exposed to, there are still inferential leaps, right? We are aware that there is some increase in immune cell function on some level post-osteopathic treatment. However, that does not mean that there's anything going on as far as improved ability to deal with a viral infection or a bacterial infection. Most of the studies done on people with respect to osteopathic treatment and the immune system are healthy people, right? So we don't have evidence supporting osteopathy as useful or better than, as useful on its own with respect to improving immune function, like actually improving immune function, or really being better than other forms of standard care. The two dominant forms of standard care are vaccination and antiviral or antibacterial medication, and good hygiene. Osteopathy does not outperform good hygiene with respect to infections. What do? We definitely improve movement. I've said that here before. We definitely, under cases where there is a mechanical driver of a patient's pain state, we can say that we can improve that. But there has to be a mechanical driver of the pain state. Pain states are often present and not related to a mechanical issue or a biomechanical issue. When we improve biomechanics objectively, or as objectively as we are able to, and pain does not change, then the pain state does not derive or develop from a mechanical problem. So, is it possible that hands-on healthcare, hands-on manipulation can be beneficial for patients who have infections? It is possible. As of yet, it is not appropriately studied for us to say so. Again, just going back to the concept of the broad message, if you do not regularly read scientific literature, do not make claims based on it. If you think something's interesting, bring it to people's attention as something that's interesting, ask for feedback, possibly engage people that you know that regularly read scientific literature and can be somewhat critical. There is skill required. There is skill required to be developed to ingest things, to take them in as far as literature is concerned. Asking myself about, great novels, I'm probably not the right person because I don't read them all that often. I don't go through the process of digesting them, of being critical of them, of understanding what's going on. I am growing my skill set consistently with respect to reading scientific literature, as many of you out there are, but I really, really caution you, do not say things that the research doesn't say. Research is highly limited in its generalizability in many cases. If it is shown to not be limited in its generalizability, then somebody's probably done something like a G study or utilized G theory. They've taken the evidence that they have, they've done statistical calculations, and they see how well it can generalize to broader circumstances. For the most part, I don't see that in any osteopathic literature. So that's not something that we can do. Read the limitations in the study. Read the conclusion. You gotta try to read the whole paper. Now, I understand that many people don't have access to scientific papers or to full papers because for whatever reason they're not paying for the subscription, or they're not affiliated with an institution that pays for the subscription for them. So most people, when sharing things, are using abstracts. Those abstracts may not contain crucial information such as the limitations of the study that are written within the full paper. So we've got to be really careful. Take your time, develop the skill. If you don't do it regularly, don't use research to support your position because you don't even know how to read the research appropriately. This is an attempt to say this in a gentle way and hopefully a disarming way. However, as this continues and as people are more essentially exposed to this, you will see their level of frustration going up. My level of frustration may go up, it may not, but I'm going to make this attempt now to say again, don't say things research doesn't say. Don't attempt to use it to your own benefit. It says what it says. Don't speak for it, it speaks for itself, especially if you read it properly. hopefully my level of frustration with this doesn't go up, and hopefully I'm able to maintain a fairly even delivery with this message, because I have said things of this nature before. I will say things of this nature again. I'm just trying to put it out there again and again as consistently as possible, and maybe from different angles, so that different people are able to latch onto it. So again, take a look at the video, take a look at the associated text. If you're on YouTube, the text will be linked below in the description. If you're on the website, while you're already there, just take a read. It does a little bit better job than what I'm doing saying right now, as far as taking different papers and just pulling some things out so that we can see how the title can be misleading, or the way people utilize that research can be misleading. My aim with the video is to just give a broad message. If you don't read scientific literature regularly, don't try to use it to support your position. You are missing stuff. Develop the skill. Once you've been reading it regularly, and once you understand what it means and how far it can go, how many things can be said about it, you will understand that you can't speak for the research. The research speaks for itself. It has limitations. They should be there. If they're not there, you have to develop another skill set of identifying the limitations of the paper when they haven't told you already, or when the authors haven't told you already. So with that, I will take my leave for now, but please be careful. Don't speak on behalf of research. It speaks on behalf of itself.